You're listening to Wellness Junkies.
Where wellness gets real, not perfect.
Welcome back to Wellness Junkies. This is Amy, and welcome to Wellness Junkies, Dr. Dovec. So let me give everyone a quick bio on Dr. Dovec because this is such an interesting conversation. Dr. Dovec is the top female bariatric weight loss surgeon in the world. She is a trailblazing surgeon and the founder and CEO of BodyByBariatrics and the Surgical Institute of Central Florida in Orlando. Over the past 12 years, she has performed more than 6,500 bariatric surgeries. Wow. Passionate about ending obesity stigma. She advocates for treating obesity as a chronic medical disease, not a personal failure, and provides unprecedented lifelong support. So very interested to hear about that and just in general, our conversation. So welcome to the show, Dr. Dovec.
Thank you, Amy. I'm very excited to be here.
So just quickly, the 6,500 surgeries kind of blows my mind. So what have you seen across all of these surgeries gives patients long-term success? Or maybe actually let's backtrack. Let's talk about what the surgery is if people that are listening don't know, and why someone would get this surgery over just, traditional weight loss methods.
Sure. So when I tell people if I'm at a party, what do you do for a living? And I'm a bariatric surgeon, and it's oh, bariatric, is that old people? I'm no, that's geriatric. So I get that all the time, but no one really knows what it is if you don't struggle with your weight. So it is what is this? You've done thousands of these? So yeah, it's almost as strange as it is, it's almost this underground thing, and it shouldn't be, because bariatric surgery is the most effective tool that exists to lose weight and to keep it off. So there are different types of bariatric surgery. I most commonly perform a gastric bypass, which also maybe you're thinking about your understanding of it. It has a lot of stigma, a lot of, I think, misconceptions still. It's a lot of stereotypes oh, you mean my 600-pound life stuff?
Right.
He has to get cut out of a house. No. Anybody whose BMI or body mass index is over 30, who has weight-related or metabolic issues, really is an excellent candidate, because it is the society that we have is for bariatric surgery, but it's metabolic surgery. So it's far superior to GLP-1 medications, but yet it remains so kind of hidden. So I do it through laparoscopic techniques, which is little tiny incisions. I use four tiny incisions, and then I basically take the stomach from about the size of a football, and with the gastric bypass, I take it down to the size of a thumb. And I bypass 95% of the stomach. So that's why it's called a gastric bypass, because 95% of the stomach is still inside, but is bypassed from seeing and storing food. So that bypass portion leads it to the first part of the small intestine, and then food and drink will go straight on down. And it's called a root in Y because it looks like the letter Y downstream. So that one, I think conceptually is challenging to see unless you maybe are Googling a picture or you're really into anatomy and you understand the gastrointestinal tract. And, I don't want to dork out here, but there's that one, which is the best, is the gold standard. It's been around for decades and decades. We're just getting better and better. It's truly state of the art. It's really efficient. It's done as an outpatient. It's very minimally invasive, like I said. So I have a surgery center, like you said in my bio. And then the other very common surgery is called the sleeve gastrectomy, which is where I take the stomach from the size of a football, and then I take it down to a garden hose size. So the actual flow of food is the same. I'm just removing the storage capacity. But one of the issues with that one is acid reflux. So that one is not chosen as often as the bypass, which is kind of the goat of all weight loss procedures.
Yeah, I actually didn't realize you don't cut someone open. For some reason, when I thought about this surgery, I thought it was a major cut open kind of surgery. I didn't realize you could do it laparoscopically.
Yeah. So I've only done it laparoscopically and all those 6,500 plus surgeries at this point. So yeah, I put 3 pinky size incisions that are less than 5 millimeters, 2 out to the side, 1 near the belly button, and then 1 that's the width of the thumb. That's about 10 millimeters to 12 millimeters. That's it. And that one is where I put a device that's called a stapler. And that's how I staple, seal, separate the tissue from itself.
So who is the ideal patient? Is it anyone over 30% BMI, or what do you see in all of the surgeries you've done?
Yeah, I think goodness. You know, when somebody comes to do surgery, there's lots of evidence that shows that the average person has tried over 22 different diets, exercise, trainers, meds, the mainstream, the crazy, the bizarre, grapefruit, like all this stuff. Like they've done it all. So I think when you get to surgery, no one is like, oh, I just woke up one day and I feel like I'm overweight. I'm going to get a gastric bypass.
Right.
Like that's never, ever been the way it goes. So I think the ideal candidate is really just anyone that's looking into it to give themselves grace that, hey, this is a really, like, again, the most effective treatment option in this chronic disease of obesity, which I think when people don't really struggle with it on the day to day, they just don't understand the psyche of it, all the limitations that weight has on your body. You're not being able to like fly or buy clothes off the rack or even ride a ride at Disney, with your kids or what have you. I think that those things, everybody has their own why. And I don't think there's any specific reason that I would say is better than another one. But I think like anybody that's really just done their homework and wants to lean in, I would love to do a consult and like just chat with them about their goals and also their struggles and where we want to take them.
And what has taught you about long-term success for patients? Like once people get this type of surgery, do they keep it off or how are you seeing that?
Yeah, I think that's another huge misconception is that, oh, why are you going to do surgery? Everyone just gains their weight back anyway. It's the easy way out. You're, again, traditional, do diet, exercise. But the reality is most patients, over 85%, will lose weight and keep it off. Now, I think, and we're going to get into it because it's the hottest conversation right now. I think the absolute best person to be on a GLP-1 medication is a post-bariatric surgery patient. So even if, let's say your BMI is now normal, let's say you're 5'4" and you now weigh 135 pounds. Great. That's fantastic. And you're pretty happy with that, but you feel like I have food noise that's coming back. I feel like I can eat a little more. I feel like, the scale is now 140, 145. I think that is where we should get maybe aggressive and really put a GLP-1 because you will be a super responder post-surgery because after surgery, that GLP-1, which is just this great thing, that will increase. You add a medication that increases GLP-1, you're going to have a synergistic effect and post-bariatric patients are going to do superb with it. And they're going to lose that extra weight. It's going to help to keep them in that nice new set point of maintenance.
Yeah. No, that makes sense because prior to having these medications, it was probably a little bit harder, I would imagine.
Absolutely. Absolutely.
And so how do you decide? I mean, it sounds like if someone's kind of at their wit's end and done everything, that's when they're ready for surgery. But how do you help them decide between medication, surgery, or a combination? Or is everyone that comes to you is just like, I know I want the surgery, like done?
Yeah, it's funny. There'll be people who have very, very high BMIs and they're like, nope, I don't want surgery. Don't even want to think about it. I want to try medications first. For whatever reason, maybe they don't feel like they're big enough. Maybe they feel like they haven't tried enough, which is always like, oh man, okay. Like, sure, we can absolutely do this. But like I said, give yourself grace, give yourself permission to say that it's okay. You can kind of look into this. I think, there's also people who have very low BMIs and maybe they have diabetes. And they're like, I'm the insulin, I'm scared of my long-term, all the, kind of sequelae from having something like diabetes. I want to have a metabolic operation because I'm just done with these associated health issues at a much lower BMI. Or maybe they try the meds. They can't tolerate the side effects. They can't afford them. They can't get access to them. Yeah. They don't want to like the idea of taking a weekly injection for the next 52 weeks for the next however many lifetime years. Like there's a lot of reasons I think that people would choose one over the other, but I can give them all the information but it's really up to them to decide kind of where they're at that moment of their journey.
Yeah. And okay, let's get into the GLPs a little bit because I'm sure it's disrupted your industry a little bit. What should people understand before looking at a GLP as a cure-all? Because I feel like everyone and their mother's on it. And like, what should people understand? Because I don't know there's so much information out there and there's not a lot of credible sources. Yes,
there's so much. And it's such a cash grab, I think. And I think that's what is making it so poisonous and so, again, misunderstood, because like, well, they said that and they said that, and I'm just so confused, but I think it's okay. The bottom line is these medications are great. And to your point, has it disrupted my industry as a bariatric surgeon? Unbelievably so. Yeah. Unbelievably so. We have again, our society has this forum, and there is a chat right now that's gotten like tens and tens of thousands of views. And it's, hey, 2025, our numbers were so down. And it's all these people like, oh man, surgery versus GLP-1s. I think that's absolutely insane thinking. I think that if you truly do believe you want to help people, you want them to lose weight, keep it off, you really want to improve access to good care, then we should really embrace all of it. So what do you need to know? What are the main things here with this? So the GLP-1s, right now, they are available, of course, as a weekly injection. There's two different types. There's Semaglutide, there's Tirzepatide. Everyone just thinks it's Ozempic. I hear that a lot. Ozempic is the brand name for Semaglutide when you have the FDA indication for diabetes. And then there is semaglutide for weight loss, which is called Wegovy. Now, yes, this is Novo Nordisk, who's the manufacturer of that. When Wegovy is an injectable, but it also just a few weeks ago here in early January 2025 or 2026 came out with a new pill form of Wegovy, a daily pill that the jury's still out on that. I don't think ultimately it will be as effective because there's already other versions of GLP-1 pills that are on the market. I'm curious to see. I've heard there's a lot of nuances with it that you have to be very, very precise in taking it every single day. Now, the other type is Tirzepatide, which is Eli Lilly. Brand name for diabetes is Mounjaro, and brand name for weight loss is called Zepbound. This one, in addition to them both being GLP-1 agonists, the Tirzepatide version is also a GIP agonist. So basically it works two different ways. It's a dual mechanism of action. So it's more effective. And anecdotally, I've heard that there's less side effects, and the side effects are typically GI tract related. Nausea is number one. It can be really wretched. You could have dry heaving, even vomiting. You can get regurgitation because it really slows your gastric emptying. So you could have some reflux. And then finally, constipation can be very severe. You could even get, impacted, and you really need to stay on top of making sure you're having regular bowel movements with it. So there's, these different types. And I think what people need to understand, especially, it is almost directly proportional to your starting BMI. So if your BMI is over 30, so the more weight you have when you start, the least likely you are to stop the meds and not gain the weight back. If you look at Eli Lilly studies themselves, that when you stop the GLP-1, when you stop the Tirzepatide, you are almost guaranteed 100% will gain their weight back. 100%. You have to understand you're signing up for a lifelong commitment to keep the results that you're getting with these medications. So that's what you got to know, that you got to know what you're signing up for from the start, because you don't just gain it back. You gain it back very quickly and potentially then some. So I think that's the thing, like, oh, I'm so happy in the here and now, but if something changes in your life circumstances, you better be careful.
Yeah, that's really interesting. And I also didn't realize that there were two different kinds per, I don't know, like, for example, Tirzepatide, there's one for diabetes and there's one for weight loss. Is it the same thing? It's just marketed differently, or is the medicine actually different?
So Eli Lilly, so it's a low dose pen. So you start at 2.5 milligrams for 4 weeks. Then you could go up to 5, 7.5, 10, 12.5. Then at month 6, 15. Exact same med, exact same dosing interval, different label slapped on it.
Okay. That's what I thought, because I was like, I didn't realize, but that's interesting. I have done both semaglutide and Tirzepatide. I definitely like Tirzepatide better. But I haven't done I've done the compounded kind that you can microdose. Yes. And I agree. I've been on and off and on and off. But when I go off, I mean, I didn't really have a lot to lose. It's 5-10 pounds. So it's kind of embarrassing, but now everybody does it. So I talk about it. But yes, every time you go off, you feel for me, it's more about I feel more bloated when I'm off of it. It's just water weight. And I feel like when I'm on it, I'm not as inflamed. It's almost like I just feel better on it, more so that yes, I lose a few pounds here or there, but it's more just I don't feel as bloated. Do you ever hear that?
Your observation is absolutely correct. So that, and just these are and these are the best anti-inflammatory. So even if you have like an autoimmune condition, rheumatoid arthritis, psoriatic arthritis, those conditions, which you're like, what the hell does this have to do with any of that? The inflammation associated is also like food noise is number one. The inflammation and bloating that you're describing, it's not in your head. Like, I feel like no, you are more bloated if you're not on it. Period.
Yeah. Yeah. Cause I just feel like the more and more these medicines are studied, the more and more people are saying like, oh, it's good for all of these other things too. It may not be marketed that way, but like it's helpful for X, Y, and Z. So that's interesting. Okay. That's good to know. Yeah. And so the oral, this is kind of the first time I've heard about this oral. I mean, I've sort of heard rumblings about it, but is that something you think is going to roll out? And like, to your point, is it as effective because it's not being injected? It's a daily pill? Like,
well, I don't think it's going to be as effective because, there's even the rumblings of like, oh, I got a compounded version of a patch. It has to do with how it's absorbed, the size of like the peptide and how it gets into your system. That's different with the different delivery methods. And the best delivery method is the injectable way. And so I think the pill form, maybe as someone like you who, I just want to lose that 5-10 pounds, you might be the ideal candidate. I do not think if I have a patient, again, BMI, they need to lose 50 pounds, 100 pounds. I would not even waste that time, energy with a Wegovy pill form. Now, and also Eli Lilly very, very soon is coming out with the oral Zepbound form as well. So, I mean, it's coming. And I mean, these pills have been around forever. Rybelsus is one of them for diabetes. And so it's just so interesting. Again, the cash grab in that we've already been making these meds and now we're going to slap on another label. And because you don't have evidence that you have diabetes. So how do you define that? You have to have blood work that shows at some point that you have a hemoglobin A1C of greater than 6.5, or you need to have a fasting glucose level greater than 126. If you have those as technically diabetes, I could prescribe you the Mounjaro, then boom, you get the pen, it's paid for, it's covered by your insurance for a different diagnosis code.
Right. So, it's all kind of smoke and mirrors. But yeah, I mean, it is a cash grab. I feel like everyone is selling it and it's scary because you don't know. I mean, I would imagine the best thing to do is be on the brands like the brand name, but I don't know. I mean, it's a little hard to know. That's
an interesting thought. Yes. So if you just look at it universally, absolutely. The brand names by Novo Nordisk and Eli Lilly, they are so heavily regulated by the Food and Drug Administration that yes, you know what you're getting. You understand you're getting the correct dosing. This is all in these different sterile environments, the packaging, the shipping, the cold handling, all of that. That is, what you're getting. Now, you have, just like you brought up, I mean, we will drop ship from very reputable pharmacies, the compounded versions. And I think this is very much so part of the conversation. So I used to say, I will only do the brand name, but I realized that again, it's a really limiting access to care because especially when it first came out and when Wegovy was your only option, Ozempic was the only option, they had the monopoly. So they were charging $1,200 a month. Now all of a sudden, there's another player, so we can decrease that. But it gives you, and the prices are coming down. So the compounded versions, I think if you get them from a great place, not like, hey, my grandma makes it down in her basement. Like, I don't know about that. Where are you sourcing this thing? I do think that there's some really great pharmacies. I know that we have one, and we send out bottles all the time, and the patients are getting results, and the side effect profiles are the same or even, minimum. And they're losing weight and it's working. And I think that they're safe and fine, efficacious.
Yeah. I also think they're easier to control. Well, I've only had the compounded kind, but for me, it seems like it's easier to control if you want to quote microdose or just have a little bit because you can, change it by the week instead of just like the prescription kind, which is just like one dose and you take it or leave it. Yeah.
That's so. You know what? I completely agree with you too. And I used to be like, no, there's this rigid dosing that's been studied and it should only be that. But then I realized yes, I think this is one type of medicine that The patient, yes, in accordance with a good program. We have lots of offerings. We even do small group therapy when people go on these every Monday night at 7 p.m. with a weight loss therapist. Mm-hmm. We have like meal plans. We do all the wraparound comprehensive support. But I do think that the patient really does dictate how this goes, because there's no like one size fits all. If you were to go, for example, and you did your 2.5, then 5, 7.5, you're like, yeah, I'd be so sick. And I think if you're a super responder, which I have no doubt that you would be a super responder, you're also super sensitive. So like if you go up higher, you're not going to be able to tolerate the nausea and that sort of thing.
Right. Right. Okay. I want to get into your thoughts on GLPs, because I have my theory, but what do I know on GLP-1s and perimenopause and menopausal women?
Oh my God. Yes.
What are your thoughts? Is it helpful? Is it not helpful? Like, what do you see?
The most helpful.
Yeah. Yeah.
The most helpful. I think that that's a whole thing that like we need to put on full blast. And I love coming on different podcasts and just like, I hope different audiences, if you're listening out there and you're a woman, the joys of being a woman. I mean, you went through probably you got your period and all the bloating and the 28-day swings with all that. And then of course you have kids. I know you've had kids, you're postpartum, again, the hormonal swings, trying to lose that weight, breastfeeding. Perimenopause is a beast. I'm 44. I'm almost 45. And it's like, what is this era now? And it is all of a sudden, there's a lot of like good things out there, about hormonal balances, estrogen, progesterone, testosterone, and how these meds play into that. I think this is a whole nother thing that I think the evidence is going to continue to evolve very favorably, that it's going to help regulate some of these hormones that like one day, like the brain fog, like where did this come from? And like the bloating and, just the retainment of weight in a way that you used to be able to like, I won't drink alcohol this weekend and I'll go for a walk. Okay,
I'll lose 5 pounds.
Right.
Yeah.
I'm back in fighting shape. I'm back to perfect. But now it's like, my tactics aren't working.
Now it's like you do that and you gain, like, at least at my age, it's like you do that and you gain weight. So it's like, where you never thought about it before. So yeah, I'm like a big proponent, and I've talked to a lot of my doctors about, GLPs as it relates to menopause and peri, and like some agree, some don't. But I think like the evidence and the studies are evolving so quickly that doctors need to evolve, because I think some are very stuck and they're like, oh, it's only for diabetes patients. Some are more open to it. Like, I think it's great that you are so like open to it about people doing it for more than just diabetes, and also that it does help with the bloating and the menopause and all of these things. Cause like, I know it has for me, and I can't imagine it wouldn't be for other people.
Absolutely. And I love your point there about just your observation that some of these PCPs are literally, I think there's a lot of shame and blame. Like people be like, why are you on the med? You're not sick enough. You're not fat enough. You're not big enough. You don't deserve it. Like save it for the diabetics. Nikki Glacier has a whole comedy routine on it. But I mean, I think that's absurd. You have this medication, you can get access to it. And I think it impacts so much more than even like physically. Yes. Health wise. Yes. The bloating, all those things, but also like mental health is a big component. If your jeans that you always wore are now, you can't get that button, or you just feel like, I just don't like the way I feel in this.
Right.
That's relevance. And we've all felt that way. And if you feel that and you're just like, you can't get it off, it's all consuming. It really spirals you, and it's depressing, and it's impacts your confidence, how you show up, your relationships, maybe intimacy, like all of that is intertwined to your overall health and well-being. And I think that we should lean into that, other than the only thing is pop culture. Oh, look at these celebrities getting too skinny. Like everybody out there, is abusing them, is disordered eating, getting more disordered. Anorexics are getting more anorexic. That is not the case. I was recently interviewed on NPR, and she was a thin Asian woman, admittedly so, that she was on the lower end. And I don't really think she thinks about some of these things. And she was just like, yeah, but isn't it just like more anorexics wanting to get more anorexic? And I'm like, no, I don't even think that's what anorexia is about. But it's, you just want to feel yourself. And I think that that's what this is all about.
Yeah. And I think also there's a way, like because I hear people, there's a lot of obviously misunderstood pieces in the media. And I hear a lot of people talk about, oh, it's like a quick fix. It's like a cheat code. Why don't you just like diet and exercise? And it drives me nuts, especially when I hear men say that, because I'm like, you know what? Like, you don't know what it's like going through menopause or perimenopause. Like, it just is different. Like, your body's gaining weight, your hormones are all over the place, and like, it's not that easy. And if you eat healthy and you exercise and you're still not like that, I think you have to have the right mindset to use it. I think, to your point, like, people with disordered eating, like, people should be careful. Their doctor should not be prescribing them, because that's like a mental health issue in and of itself. But if you're healthy and you lead a healthy, clean lifestyle and it still like bothers you, it's different. And so when you hear people talk about, oh, it's such an easy fix, and like, you're taking the easy way out, it drives me crazy. Because I'm like, no, not really. But you don't know, because you haven't been through it.
You don't get it. You're not there every day when I'm taking my walks and I'm doing my weightlifting and I'm, all the things. Again, stay in your own lane. The shame and blame game has no place here, but yet it is the center of the conversation. So I applaud you for saying, like, yeah, I'm on this thing, and I love it. I love that I didn't know if you were on it or not, and what your wellness.
Well, now I feel like everyone is at this point, literally.
Yes.
Like, people used to like be secretive about it, and now I just feel like everybody's microdosing. They're on and off of it. Like, I was off for a while, I was on for a while, and I'm like, whatever, But I was doing it, especially because of my podcast and like just being in this industry. I like learned about this stuff like a couple of years ago. I feel like before it was as mainstream, and I had learned about it actually through the show, through interviewing someone, and then I was like, oh, I want to try that. So I did it for a while. It was great. I went off. I went back. So I've just like played around with it. But I think now much more people are talking about it, and it's not getting as bad of a rap, but it still gets a bad rap. I mean, I just think it's really misunderstood.
Yeah. Ugh, I hate the judgment. Absolutely.
Yeah. But who cares? Let them, as Mel Robbins would
let
say.
them. Thanks, Mel.
Are the surgeries that you're doing mostly on men or women?
85% are women.
Interesting.
And that's not just me. I do, have a female bariatric surgeon partner. My dietitian's female. My physician assistant's female. My entire team is female. It has nothing to do with that. Nationally, out of all the bariatric surgeries that are done, about 80 to 85% are female. And I think that also goes back to, like, especially men judging you. I think that, again, society's acceptance of the dad bod is cool. Women were held at a different standard. Like, the more affluent you are, the more you got to show up and, be tight. Men, I don't know. Like, it's fine. Like, oh, like you're 20, 25 pounds overweight. You really can't even tell. I don't know. It's just more acceptable, I think.
Yeah, it's funny. For some reason, I would think men would get this more because it's like a one and done instead of having to like take a medication or whatever. But interesting. And men
that come are often way sicker too. It's like, dude, why didn't you come me? And the men, so there's different types of fat as well. So there's the dangerous fat that you've heard of, the central fat, the visceral fat.
Yeah.
That's the man that looks like they have the beer belly kind of like sticking out like that. Their abdominal walls are like this thin. That means it's all internal, but that's the dangerous ones that, hey, so-and-so died in their sleep because they had a cardiovascular event, a heart attack, a stroke. They have significantly fatty livers with that distribution. Skinny arms and skinny legs. I'm like, oh God, that's going to be so technically hard for me to do. Mm-hmm. And then there are, the female distribution is that, the pear shape, typically more breasts and then hips and buttocks, and their abdomens, might have thicker abdominal walls because their weight's in their subcutaneous tissue. Mm-hmm. But on the inside, they're very thin. They don't have much, momentum or fat, like the mesentery and all of that is much thinner, than usually men. So men have associated with it the diabetes, the sleep apnea, the really big necks, the difficult airways. I mean, that's when a lot of times they come, and I wish that men would come a lot earlier too. It'll just be so much more beneficial.
Yeah, there's not a lot. I feel like I hear that word a lot, the visceral fat, but I don't think there's a lot of education on why it's so dangerous. Because I think, to your point, like, a lot of men have these bellies and like they don't realize, like, okay, not only are they like not healthy generally, but like it's actually really dangerous. Can you talk about that a little bit more?
Yeah. I mean, it's just like, even like visually, I have been inside of 6,500 abdomens or more at this point, probably. And it's just the way the fat is even the color, the thickness, the appearance, the friability, the inflammatory nature. When you're grabbing this thick boggy fats, this diabetic fat, I call it. I'm like, I can tell if you're a diabetic by looking at the way your fat looks on the inside.
Wow.
Without a doubt. And another fun fact, I can tell if you specifically drink McDonald's drinks.
What?
The way your liver looks.
No way.
I absolutely can. They add so much sugar to their sweet tea that your liver will be, it looks like a hamburger. It looks so thick and fatty versus, I would assume that you don't go to McDonald's and drink the orange drink or the sweet tea.
No.
Your liver will be very maroon and it will be very thin. So that's just sort of that. There's something called MASH, or even MASH, we call it. Is non-alcoholic steatohepatitis, which is another word for fatty liver disease. Fatty liver disease is the number one reason for a necessity of a liver transplant, even over alcohol abuse. So it's like, what's wrong with my liver? I don't drink. But you're consuming sugar. Sugar is I think the most poisonous, toxic part of our diet. And if you can do nothing else but minimize added sugar, particularly if you can stop drinking sugar, the sodas, I mean, there's 56 grams of sugar in a soda, the fruit juices, the regular sports drinks, the Starbucks, my loves, get away from there. The sweetened creamers, the extra squirts of syrups, all of those things that you're like, I got to start my day off this. Give me like 10 squirts. And
so gross.
Sugar
so much
is
sugar.
More addictive than crack. Cocaine is more addictive than heroin. You're not going to be able, you have to almost go through a withdrawal of it. That's a whole thing with the food and drug industry, or the food industry, and just food scientists, and how, sugar, fat, and salt is that secret formula on how they're going to get you cooked. We're putting bacon on ice cream now, my friends, because we want to make sure that we get your money.
And it's America. I mean, I don't know the stats, but I feel like America, everyone is so much heavier than any other place. Like we were in Europe over the holidays, and like literally there's no one overweight.
Yeah, absolutely.
I mean, I was walking around and all of a sudden I said, no one's overweight here.
I know. That is the truth. And that's because it's just a lot of like fresh foods. It's not this synthetic, processed, high fructose corn syrup, high sugar added. We're adding sugar to French fries. Like what is going on here?
I know, it should be illegal. It's terrible. So with the GLP-1s, can men lose visceral fat from those? Is it just like if they lose weight, the visceral fat will decrease?
Exactly. Yeah. And the way you lose weight actually is kind of interesting, is that you will blow it out. You'll exhale it in your CO2. So yeah, all the equations and all that, you will chemically, hormonally, metabolically, all of that visceral, internal, dangerous fat will absolutely thin out. So if, for example, if I were to go back inside, GLP-1s do this, but surgery, same thing, does it as well. If I were to go back inside your abdomen after bariatric surgery, and let's say you're a man, you lost a lot of weight, but you didn't quite get to where you needed to be. So I need to be back in your abdomen needed your gallbladder, whatever. Mm-hmm. Even if your weight loss, the number on the scale wasn't really quite where you wanted it to be yet, your visceral fat looks so different after this. It looks so thin. It's like this thin sheath of omentum, which again is the fatty apron that covers your insides or your intestines. Mm-hmm. And the characteristics of the fat are definitely undeniably changed after GLP-1s or surgery.
Yeah, and so much healthier. And then and you were saying about the fatty liver, that's caused from sugar, like high fat, sugar, alcohol, all that stuff.
Exactly. The number one thing is truly sugar, and the way that we break it down in the liver's involvement, glucagon, glucose, all of those types of things. There's coming out a new medication soon, which they don't know if, I think it has a horrific amount of side effects, but it's GLP, is GIP, and it's glucagon. And that has to do with all of that as well. So that's on the horizon too. So yeah, the liver is heavily involved with the way it breaks down glucose and insulin and in that whole cascade of events. So yeah.
Yeah. I mean, I do see some positive change with the food. I mean, it's still horrible. But for example, you're saying, cut out the soda and all the like sugary drinks, which I did a million years ago. However, now there's like Olipop and Poppy and all these, like my sons will drink, I think it's called Izzy and it's like a soda, but it's not as much sugar, or like the Olipop or the Poppy, and it's so much better.
Yes.
And it tastes great. And so it's like there's actually alternatives other than water. So there's no excuse not to have the McDonald's.
I mean, I
It's so
agree. The
gross about
flavors are
McDonald's.
there. I think they're great. And I also, for the record, I do not think there's anything wrong with the sugar substitutes. The Splenda, all of that. I know
Really?
that aspartame gets a lot of bad rap, but if you look at it like, oh, that causes cancer. No, there's no, like in the amounts that they're studying, you'd have to drink like, it was something, I don't remember, I'm quoting this wrong, but it was something like 50 gallons of like Diet Coke a day to equal what they're trying to propose. So I think sugar substitutes are fine. I do. Diet Coke, I think all of that is fine.
Good to know. Okay. For all you Diet Coke drinkers, there's
I
a
know.
lot of people who love that Diet Coke. I do not like it. I don't like the taste of it, but I wish I did because it looks good.
I know it looks refreshing. I don't drink caffeine. I just want to be high on life over here. So yeah,
Wow.
I try to avoid that. And then post-bariatric patients don't really do the carbonation because their stomachs are so small to be able to kind of like burp or get that kind of, pop the Tupperware, if you will. You don't have the rest of your stomach to kind of help to get that air out. So it'll kind of get trapped and it can be very uncomfortable. So, they cannot tend to tolerate carbonation.
How many surgeries do you do a day?
I can do up to 12 in a day.
What?
Yeah.
Wait, how long does the surgery take?
A gastric bypass takes me about 45 minutes and a sleeve is about 20 to 30 minutes.
I didn't realize it was that short.
Well, we're really efficient. I'll tell you, like when I got started, a bypass would be like 2 hours. And then it becomes, there's actually a line from, ironically, the McDonald's movie, The Founder, where it's when he was in there looking at like, how do you guys make these burgers so quickly? He's like, we're striving for a symphony of efficiency, not a wasted motion. And that's really the OR is like a symphony. It's really like a pit crew. Everybody knows their assignment. You're not doing duplicate efforts, running around like, we're very efficient. It's such muscle memory. I know that this is a weird thing to say, but I know the anatomy of like foregut anatomy, upper GI tract anatomy better than I know my own kids' faces. Like I just feel like I'm always staring. I'm more staring at that than even at my own kids or my husband.
Yeah. Wow. And what's the recovery for a patient? Because you said it's outpatient.
It's outpatient, especially the gastric bypass has an easier recovery. With the sleeve, I have to put one deep stitch because I remove the stomach with the sleeve. And so I have to put a deep stitch in the muscle to pull that fascia back together. But the bypass, I think the recovery is 12 to 20 hours. By the very next day, you've turned a corner if you get a good night's sleep. And so their only agenda item on day 0 after surgery is to sleep. If they get a good night, uninterrupted consecutive hours of sleep, they wake up, they take a long warm shower, and then they're pretty functional. They're walking, they're moving around. So yeah, I think most people take a week or so off of work, but you could take as little as just one day or as much as 4 weeks off of work.
Wow. Never knew that. Okay. So let's switch gears a little bit.
Yes.
You are a busy woman and I want to hear about some of your favorites here. So we're going to get into our wrap session. So
Okay.
what is your favorite wellness or beauty hack?
Well, this is odd. It's kind of like an old lady thing.
I love it.
I will get my hair blown out once a week. So I have somebody else who will shampoo it and blow it out and do it perfectly. And then I use dry shampoo. So I'm blonde. So this is the last day. So I'm like, gosh, I'm looking at myself like, oh God, I'm like on day 6 of 7.
Me too.
Blowout.
I like try to make it last as long as possible. So you do it every week. That's good.
Just once a week. I never waste. I am busy, so I don't. And so I'm working and I'm answering patients or I'm doing whatever, on the computer, always on a laptop. She comes to my house.
Great.
She, I think the ROI on this hair thing, because I'm always kind of put together. Like I can't do my own hair. Like it's kind of curly, kind of straight. Like I can't really do it. Again, this is not my best look right now, but I think that's the number one thing. I'm very fast at doing makeup, but the other thing, I'll put a base on and then she will also put fake eyelashes on me and she'll enhance me up very quickly. It's all about, everything's about efficiency.
Right. And then you're ready to go. You don't even need to do anything.
Yeah. So I do that. The other thing, this is my craziest beauty hack, which I know is a lot of people can't do, but and serendipitously, the universe had it that I built this surgery center. And so it's a 15,000 square foot building. So 10,000 square feet is the surgery center. And we have like 3 ORs, 2 procedure rooms, pre-op, PACU, recovery, the whole thing. And then the other 5,000 square feet is office space. So I see all of my medical weight loss GLP-1 patients virtually. I see all of my pre-op and lifelong follow-up patients virtually. So everything since COVID, for 6 years, I've only done virtual. Oh, wow. So I have 8 exam rooms over here. And I thought I was going to have a GI group come and do, EGDs and colonoscopies and all that kind of stuff. So they were going to do the office space and then do the procedures over there. But at the final hour, it didn't work out. It was a long story. And then I convinced my best friend from training, who was in LA doing cosmetic plastic surgery. I said, come on, you got to come over here and do all the body contouring after weight loss, all of this. So to finally get to the point of this is because I'm like, I have all these exam rooms they just pulled out. I'm like, we're doing a med spa. So we converted we have a 5-room med spa with all the lasers, microneedling, Botox, fillers, lips, peels, facial estheticians. I do all the things. So my biggest beauty hack is that between cases, I'll come over and get constantly getting needles in my face. So that's
convenient.
Own a med spa, and then you just get free services on demand. So
what's your favorite service?
My best way of
what's your favorite service? What do you like to do the best?
Well, I mean, Botox is foundational. My favorite thing is this IPL, that we have that's called Tight and Bright. And it's also the same machine that you can do laser hair removal. I like it. It doesn't hurt. It's really great. The Scarlet, the microneedling is that's depths of pal. There's this thing called Nuvaderm, which is an ablative therapy. It's like a blowtorch on your face. I mean, you got to kind of go out of body with some of this stuff. I think we do to look good, but, yeah, it's intense, but I like that. I love getting my lips done. I love filler. We have, the plasma PRP.
Oh, PRP in the under eyes. Yeah.
Yeah. That stuff is the bomb. I'm doing the Nefertiti at my neck.
What's that for the neck? I've never heard of that.
The platysmal band. See these? Oh, I'm overdue.
Oh, you get Botox in those.
I get so much Botox in them in different places. So the marionette strings here, the gels. Listen.
Well, you look great, but you look natural. You don't look like you have all this stuff done. So I love it.
No, I tried it. Yeah, I get it done a lot. And then the facials, we have the whole, all the things.
It's a whole self-care situation there. I love it.
Yeah. So that's my beauty hack. Just own and operate a med spa so that you can do whatever you want when you want to do it.
Yeah. So you kind of went through this with your quick beauty routine, but say it's the weekend and you're, I don't know, going out at night or something. And you just have 5 minutes to get ready, you're going out with your girlfriends or something. What's your quick beauty routine? You just got out of the shower, Uber called. You're I got to throw on something really quick. What are you doing?
Well, obviously the dry shampoo, but as far as makeup, blonde, my eyelashes are non-existent. I have to have mascara. If I literally have no time. See, the thing is, I'm always late. So I just make the Uber wait or some ridiculous thing. That's not the point of the question. I'm a time optimist, which is really just rude. I know. But yes, always mascara. I can put my makeup on though in 5 minutes or less. So I would do foundation, some, bronzer, blush. I would do 3 different types of eyeshadow. I do the liquid eyeliner, which I've heard makeup artists say, how do you put on a liquid eyeliner in a rush? You don't, but I do. I put liquid eyeliner on because I think it's, again, more efficient than putting on any other pencil. It comes out faster.
Yeah.
Mascara and then lipstick, and that's it. It takes me 4 to 5 minutes.
What brands are we using? What mascara? What blush?
I use a lot of MAC. And I like Charlotte Tilbury. So I use Pillow Talk for the lips.
Yeah.
I use the MAC, one of these ones that are enhance your lips. So I'm getting them filled.
Yeah, like a lip plumper.
All that on top of it. I'm also MAC. Pretty much everything else is a lot of just MAC products, Charlotte Tilbury, and Yeah. And then sometimes I hate to say it, but like CVS brand sometimes too for some of the eyeshadows.
I love drugstore finds.
The drugstore.
They're the best.
Totally.
It's gotten so much better too. Okay. What's the one product you've repurchased more than you can count?
It would be the Pillow Talk. I have purchased that 50 times. Cause it goes, I'm constantly reapplying it. So I blaze through it. The Revlon liquid eyeliner is another one. The MAC, mascara, I always try to do something that's like lifting, enhancing, lengthening. I would not do waterproof though, because that's a thing. But my number one thing that I purchase more than anything else, and Bezos and Amazon know that I need it every week, is I purchase tons and tons of Neutrogena makeup removing wipes, which is not the way you should wash your hair, your face. You should put on the cleanser. You should put on the toner. You should put on the moisturizer. I don't do any of that. I just take it off with the Neutrogena makeup remover wipes, and they work great no matter where I'm at. Nothing's as good as this.
That's it. Okay. And you are a busy woman. You're doing surgery. You're running your practice. So how do you maintain your daily nirvana? How are you keeping it all balanced?
Well, I always see people ask, how do you do it all? I do not. I have a lot of help. So I have a husband who I ruined his charmed life. He had a great life. He was a stay-at-home dad. We have 3 kids too. And I had 3 kids in 34 months. So that was a whole thing. None of them are twins. And so they're now 10, 8, and 7. So he was the main one. I was the surgeon. I was hospital employed until I was like, I'm quitting this job. I'm leaving the comfort of the hospital, and I'm going to, let's just go to the bank and take out like a $12 million loan or something. And like, just build this. So that, guess who is now literally taking out the trash and doing our inventory and doing the payroll? My poor husband. So he's on the scene and he's here. So he helps me immensely. I have a housekeeper and it's such a necessary luxury. Like, I do not cook. I do not do laundry. I do not do anything, unfortunately, stereotypically female. She cleans the house. She takes my kids to swim, and then I pick them up, and then I do homework and all that stuff. So I think, how do I keep my zen? I love a 4 Seasons massage. So I do that a lot. I have my girl, Gwen, shout out to her. I hope no one else hears that in the Orlando area because she's mine. So I do that a lot. I try to read. I do find some nirvana and doom scrolling. I don't know. I know it's bad at night. It's like, oh, I deserve this too. I don't know. Maybe the dopamine rush. And, I do exercise a lot, just simple stuff, simple cardio, walking, stair climber. I play tennis. So I make time for it all. Again, why I'm always late. So don't quite fit in it, but I do.
I know. I always said like my tagline should be consistently 5 minutes late. I'm trying to work on it, but it's tough. Okay. And where can everybody find you?
Yes. So I'm on Instagram as Dr. Dovec, DRDOVEC. And then you can find me everywhere else on Instagram, Facebook, TikTok, YouTube, on our website. It's BodyByBariatrics. That's all one word, or BodyByBariatrics.com. And you could see we have a blog, we have a podcast, we have an events calendar. We're doing a huge in-person wellness retreat. It is on May 1st and 2nd here in Orlando at Rose and Shingle Creek Resort and Spa. Nice. So anybody on a personal development journey who just wants to kind of visualize their best life and really think about it from a health standpoint, a wellness standpoint, a style standpoint, a money standpoint, all the things, we are coming together. So we're hoping for hundreds of people to attend that, but everything is Body by Bariatrics.
Awesome. Thank you so much for being on the show. This was very educational.
Thank you. I enjoyed it. I love getting to chat with you. Thank you for the opportunity.
Thanks for listening to Wellness Junkies. For more on today's episode, follow us on Instagram at Wellness Junkies Official and find us on TikTok and YouTube at Wellness Junkies. You can also head to wellnessjunkiesofficial.com for expanded show notes, product links, and more. If you love the episode, leave a review and share it with a friend. We appreciate the love. Catch you next week. Bye.